Welcome back to this. I am your host, Nisi Edwards. Black Menace is all about survival steps to beat COVID-19 for African Americans. And I have a guest with me today, Dr. Petrina Craine. She hails from Memphis, Tennessee. She completed her undergraduate studies at Duke University in Durham, North Carolina. She pursued her medical degree at the University of Tennessee Health Science Center in Memphis, Tennessee. After finishing her emergency medicine residency at Alameda County Medical Center, Highland Hospital in Oakland, California, she crossed the coast to continue to practice emergency medicine in the great state of New York. Her interests include advocating for underserved communities, promoting diversity and inclusion, and creating health media as a physician journalist. Welcome, Dr. Craine, to Black Menace. How are you today?
Thank you, Ms. Edwards. I'm happy to be here.
Awesome. So you are, from what I just noticed, you are on the East Coast, correct?
Yes, correct. Mm-hmm.
Definitely in the heart of things.
Yes, we have really been seeing coronavirus, especially when it first hit here in the East Coast, and all the negative effects from it.
Wow. Yeah. I have a couple of questions about COVID. There's been so much in the media. I don't know how much of it is true based upon everything that we've been seeing, but why are we being affected?
All right. We don't exactly know why we as African Americans are being affected by coronavirus, but I'm going to break it down in terms of what we think are the glaring reasons that we're being affected by it. But first, I do want to give you some numbers about African Americans and coronavirus. We know for a fact that in terms of there's some data from multiple states and also including the District of Columbia, that we are disproportionately being affected negatively by the virus. The virus doesn't discriminate with who it infects, but how it affects us is really bad. It's terrible. For instance, 1 in 2,000 Black Americans are more likely to die from coronavirus versus 1 in 4,700 of white Americans. So when you break down those numbers, that's about 50 people dying from coronavirus every 100,000 for Black Americans, but only like about 20 people per 100,000 for white Americans. And then where I am now in New York, the data that we're seeing nationally, we also see that on a local basis here, and that Black Americans are more likely to test positive for coronavirus. They're more likely to be put in the hospital for effects from coronavirus. And unfortunately, they're more likely to suffer from complications from coronavirus, with that also being death.
Wow.
Yeah, those are crazy numbers. And we are seeing also some numbers like that that are also not so good for other members of communities of color, such as the Hispanic community. Now, for African Americans and thinking about why we are so disproportionately affected by this disease, like I said, we don't know exactly why. We're learning more about this virus each and every day, and our knowledge, what we learn today may actually change tomorrow. But we do think why we're disproportionately affected about it has to deal with thinking about this concept of social determinants of health. That's an academic term to talk about the way that we live, the way that we work, the way that we interact with others, how that affects our health. And me being an emergency medicine physician, seeing social determinants of health is something that I deal with on a daily basis, being on the front lines of really everything that happens in healthcare. And even as an emergency medicine doctor, our society have created patients to better address these social determinants of health. So I want us to talk about those and think about them in these different ways. So let's think about how we live, how we work, how we heal, and also how we. So thinking about how we live. There's data to show that us as a people, we're more likely to live in densely populated areas where the ability to do recommendations such as National Health Organization's recommendations to do social distancing is actually quite difficult to do if you're so crowded, almost like sardines in urban housing, public housing, stuff like that. Also related to that, we're more likely as a people to also have multi-generational housing, so to speak, where a mother and father can be living with a grandmother and also living with kids. And so if you think about that, having multiple people in housing harder to practice this social distancing, especially if you don't have a lot of rooms in the house to actually do this. And so there are people who are more vulnerable to the disease, like I said, elderly, that were more likely to transmit the disease to them just because they're not able to properly socially isolate them. Also related to the housing, how we're in more densely populated areas, there have been associations between the quality of the environmental conditions of those areas, with them being poor, such as the air quality, and how that links to higher rates of diseases such as asthma, and how that relates to more likely to get the coronavirus, or if you get the coronavirus, more likely to suffer complications from it. So that's all very important. And also related to how we live, think about like how we shop. So African Americans, there are a larger number of us, unfortunately, who actually live in areas where there's food insecurity, including food deserts, where there's lack of access to healthy fruits and vegetables. And all of that relates to how we live and how that affects, and how coronavirus affects us. So moving on from how we live, we also need to think about, like I said, how we work. And so for us, a number of us actually in the African American community, we are the critical essential workers that everyone is talking about. I myself, a number of people in healthcare, people in the food service industry, people also in the environmental services industry, like cleaning services, janitorial services, we're all required to go to work during this coronavirus. And so doing that, we also are more likely to come in contact with people who are infected with the virus and also being infected ourselves. And I myself have unfortunately had colleagues who have suffered from this disease and some who have succumbed from it. African Americans are also less likely to be able to take paid leave and also have the ability to self-quarantine. For some, depending on where you work, your job, you may not have paid leave. So it's harder for you to take off from work because that's just a big economic distress for you. And also related to that, we know that, as you probably have seen during this pandemic, that we are losing jobs. I mean, everyone's losing jobs, but it is really also affecting our community, and that has its own deleterious effects. There was a poll that came out, I want to say a couple of months ago, that spoke to the emergency savings of African Americans. Only 27% of us actually had enough savings for 3 months to cover 3 months of expenses compared to our white neighbors here. And so we can't really navigate the financial distress. We don't have the resources to do that. And so going to work, so I'll say we don't have the financial resources to deal with the financial stress. There's also been data to show that Black small businesses are less likely to get financial lending, such as through the Paycheck Protection Program. And so that is causing economic distress in our community. And all of that's related to how we work. We're also more likely to have to take public transportation to have to get to work. And that also affects our ability to get the virus. Because if you have to take public transportation, again, you're more likely to come in contact with people who are being infected by the disease. So moving on also from how we live and how we also work, it's also how we heal. And so that's my expertise, especially medical. So you think about medical conditions, and there is this understanding that there are those of us who have chronic conditions. So you could have obesity, hypertension, diabetes, and how many of us who have these diseases that could be, not that they're caused by certain things, but definitely if you don't have access to healthy fresh fruits and vegetables, that could all relate to you, to the disease being poorly controlled, and how there are a number of us who have that. So us getting coronavirus, we're sicker already at baseline. So then when this comes into our bodies, it's often fatal, unfortunately. There are also a number of us who have a problem with access to healthcare, such as there was some data that they say that 70% of those in the African American community have a dearth of primary care physicians. So basically a primary care physician desert, if you could say. There's also data that there's a number of us who live in urban communities and we actually don't have a trauma center within 5 miles of us. And that's, so you could imagine if you're someone who is shot or unfortunately you get in a car accident, those seconds between where you could get to a trauma center that's within your area within 5 miles and not can make a difference with your life.
Yes.
Also, yeah. Also related to that is a number of us are inadequately insured or also uninsured. There are also a number of us that we actually mistrust the medical system, and there's a history of that. There could be language barriers for that, fear of being deported if you're an immigrant. Uh, Also related to the mistrust, maybe we don't want to actually, there's a fear of actually seeking medical care because of things like the Tuskegee.
Yeah. So in terms of how we heal, since many of us are in urban areas, some may be in suburban areas too, but if you're in an urban area where there is a food desert, you don't have access to fresh fruits and vegetables, quality, good foods, I mean, what do you do?
That's a very good question. And I think what we need to understand that we as a people, unfortunately, have had many struggles, whether it's the struggles of slavery or the struggles of lack of civil rights. And so we have this ability to work through these struggles. And so thinking about like the question you're posing to me, if you don't have access to healthy and fresher fruits and vegetables yourselves, what resources can you use amongst yourself and your community to get access to that? So could you start a community garden or even like a garden, window garden in your house to grow certain things? Are you able to actually petition and also encourage if you're only access to a store as a corner store, the corner store to actually provide those services? Is there a way for local organizations such as churches to come together and pool their resources and sign up for like a food co-op that that delivers healthy fresh fruits and vegetables and make that at the church, those items delivered to the church where people could come to the church and pick that up? Could that be a part of like a food ministry, so to speak? I think we have to be creative in the different ways that we think about how we can address like these certain issues. Because I always tell people also the umbrella, unfortunately, where a lot of these issues are, you have to think about is racism.
Yes.
Racism as a Black American is something that unfortunately you encounter every day. And going back to thinking about all the social determinants of health and how they affect coronavirus, I mean, that's a big factor too. For instance, we know that implicit bias of medical providers themselves can affect you as an African American. They're African Americans in terms of treating their pain. Their pain is not treated as well as non-Black Americans, non-Blacks, I would say, because we're believed for some implicit bias that we have a higher pain threshold, so we don't need as much pain medication as others. There's also data about and how we are able to navigate getting access to emergency care, EMS systems, and how there's data about how EMS can take you to different places based off of your race. And so you just have to appreciate that all these things are very intricate, especially racism being an overarching umbrella, and how you can better navigate those things, racism, to better take care of ourselves.
Yes, and all those things that you mentioned, we know do occur: food deserts, healthcare disparities, places and situations where people who need access to services don't take them to the nearest hospital. They're going to take them someplace else where they're going to receive inferior care. Very unfortunate. And all these things you listed also too, Dr. Craine, what came to my mind immediately was trauma on top of trauma, more trauma.
Yeah, definitely. Yeah. And related to that trauma, you can imagine that causes like chronic stress on us as a people and as a community. And I really push this like for everyone, but you have to appreciate the amount of stress that you're under as a person in general, but also as a Black American, and what you can do to help lower the stress. Because that stress does affect you in so many different ways, but it does also affect your health. And as we're trying to better fight this coronavirus, having that in your life is not helpful at all.
So, question: have a Caucasian person that maybe is obese as well, has comorbidities, and then you have the African American patient with the same. Is it the reason why sometimes it's harder on us because of our own stressors versus their stressors? I mean, because some of them, don't get me wrong, some of them have issues too, but some of them don't have to necessarily worry about where their last meal is coming from. Some of them are able to get away, whereas sometimes we're just so congested and on top, of one another. Some of them may not live in an urban area, and some may. So that's why I'm just wondering, why is it different for them than us?
Yeah, I think our own stressors, with racism being a big part of that, that's a big factor. And there's actually data that speaks to that. There was a study that was looking at maternal mortality in Black women versus white women. And even if you account for people who have the same level of education, you have the same level of income, basically the same level of access to medical care, there's a higher mortality rate, 3 to 4 times more in Black women than it is in white women. And the reason for that, I think one of our own stressors is dealing with internal racism. So that is a reason, I believe.
I used to work with the field of medical education a number of years ago, and would travel across the country to various medical meetings because I was working for a company where we funded medical education grants. And I'll never forget, I was at this meeting in Philadelphia, at a medical meeting, having dinner with several docs. And one of the questions came up about if a patient presents to your office and doesn't ask questions about their care, how do they treat it, just general questions, what is your take? Some of them made the comment that if you come into their office and you don't ask questions and they just perceive you as being someone that doesn't care about your health, and they don't value you as much as the next person. That always stuck with me, because I said to them, I said, listen, sometimes it's not a matter of not caring about your health or your body. It's a matter of you don't know what you don't know. You don't know what questions to ask. Sometimes it's of us waiting and hoping that the doctor would engage with us, and information. So I feel also plays a role with advocacy, in terms that we need to become our own health advocate. We need to advocate and speak up for ourselves.
Yeah, that's very true. Because what people need to understand is that health literacy is way different from general literacy, general education. I mean, I have college professors who have questions about, if I diagnose them with a certain disease, as they should, because this is a foreign language to many people. So being able to learn how to advocate for yourself is very important, even if it's even write your questions down, before you go to your doctor visit, or if you're able to have someone accompany you that may be more vocal and advocating for you. Sometimes having that partner with you in that examining room at that time can help mitigate some of those issues.
True. And I sometimes tell members of my support group and other people that I work with that before you go to that visit, take the time to make a list of the questions you have. So before you go to that visit, if you've noticed something off with you, or if you've been checking your blood pressure, your glucose, and you've noticed that it seems to be all over the place, you're not certain you're eating the way you should, make note of that. Likewise, if you've noticed that, hey, I now got chest pains or acid reflux, heartburn, whatever it is, pains, make note of that, so that when you go and see your doctor, you can have that dialogue, because you may not be able to get another appointment for months, depending upon, especially if they're a specialist.
Yeah, and that's true. And that also goes back to your earlier question about, we have these different issues, such as I talked about when I broke it down, and how we live, how we work, how we heal. And obviously, for coronavirus, the best thing would be to have a cure for coronavirus, right?
Yeah.
Hopefully that would be the case, but we don't have that right now. Just the same thing with some of these issues with social determinants of health. We don't have any quick fixes, but there are things that you can do to try to address those different things. We talked about different things you can when you're interacting with a medical provider. I would also advocate and also push for that's a reason why I'm very much encouragement, also an advocate for having physicians who also look like you, because there can be this conversation that, not that other colleagues of color cannot take good care of you. That's totally not true. But there is something about having that relationship with someone that looks like you, a difference. And I've even had a story where there was a patient where she was basically deemed of having maybe some sort of psychiatric disease because she was wrapping her hair a certain way with a sock. and this is while she was in the hospital. But so when I interacted talking to her, she was wrapping her hair with a sock because she didn't have her headscarf to wrap her hair. It's not that she has a psychiatric illness and is
Right.
crazy from doing this, but she didn't have a headscarf. So her best thing was to wrap her hair with a sock. But no one specifically asked her, why are you wrapping your hair with a sock? Whereas for many Black people, one way we do take care of our hair is to wrap it at night. And you would know that if that is part of your experience being a Black person. So
I find American provider that looks like me that can relate to me, because I just feel for me it's easier because if I'm talking about different things, so let's say you're an older patient and when it comes to diabetes, you may just refer to it as sugar, okay? Not glucose, just different words within your community. And they will understand and know how to explain certain things to you, where someone else that may not be African American may not have that cultural competency to understand, those differences culturally, even with the language, because I feel that language plays a role with this.
Yeah, it definitely does.
Now, what are some of the tips that you give to your patients to spread of the coronavirus?
In terms of how to help not get coronavirus, or
How not to get,
coronavirus?
as well as if you have it, what you need to do to protect yourself.
I think the first thing about figuring out how to protect yourself from coronavirus is to see what you can do to prevent it in the first place. So the things that are being recommended, such as cleaning, washing your hands, if you can, like socially isolate as much as you can, wearing a mask, that's mostly to prevent also infecting others. Those things are also important. If you have coronavirus, I think it's important for people to know that the emergency room, it's kind of a catch-22. In many ways, it's a dangerous place for people because we have a lot of people infected by coronavirus, and you go into the emergency room can increase your risk of actually getting the disease itself if you didn't have it. But as an emergency medicine provider, I'm here for patients 24 hours a day, 7 days a week. And if you feel like you need to come to the emergency room or the hospital, like, we are here to take care of you. And I tell people, especially if, let's say you found out you're infected with coronavirus and you're experiencing symptoms such as you're feeling shortness of breath, you're feeling what's considered an extreme severe cough to you, their skin color changes, some people have these pulse oximeters and their oxygen levels are low. Anything at all that worries you about you having coronavirus during this time, then you should come to the emergency room. Because also I tell people, remember that coronavirus is similar to other viruses. It's like the flu and like the common cold, which also can be in some cases a different types of coronavirus. And you wouldn't run to the emergency room just if you had a cold. It's something about that particular cold that's different for you that you're not able to manage your symptoms at home. If you're not able to do that, that's one thing I would encourage people to go to the ER to have a medical provider evaluate you. Other tips?
Oh no, I'm sorry, go right ahead.
Other tips that I give patients is to also have their own first aid kit where it's stocked with different things that you would need. So for instance, I think about it in different ways. I want things in my first aid kit that I would need, such as medicines, including prescription medicines that I know it's been better in terms of delivery, but for a while, and that supply. So in that first aid kit, they should have medicines, so such as general medicines that can support symptoms if you get something like coronavirus, like Tylenol. But also, if you have specific medicines for your specific health condition, like high blood pressure or diabetes, and making sure you have an adequate supply of that in your first aid kit. Because as we have seen, especially when this coronavirus first hit and trying to get certain items, there was a backup in that supply chain. And so being prepared and having those items already in your first aid kit, I think that's also very important. You're going to have general items like Band-Aids, stuff that you may need if you ever get some kind of cut or bleed. But also, I would also encourage you in that first aid kit also to have items that can also just make you feel better. Like if you like peppermint candy, put that in the first aid kit too, because people weren't able to get toilet paper for a while. So you can put some of those kind of things in your first aid kit. And so I would encourage everyone to have that, especially if you are feeling sick.
Okay. Now, Tylenol, I wanted to ask you about that because was it Tylenol they were saying we should stay away from, or was it some other OTC?
It was another OTC, the non-steroidal anti-inflammatories, NSAIDs. Yeah, like
They can,
Aleve.
yes.
Yeah, because there was some data that came out where there were people who were taking medications and they seemed to get worse with coronavirus. There's some data that may also show that may not be true. Again, we're still trying to learn more about this disease. And so there are people who even take these medicines, like they're part of their daily medicine regimen. And so I would advise someone, if you're on these medicines, don't just stop it. Like, please talk to if you were to get coronavirus, don't just stop it. Like, please talk to your medical provider best to do. But I do understand people want to exercise caution in terms of taking the medicine. So if you can, when I'm taking care of patients, I do tend to give them Tylenol more over giving them the NSAIDs if there's a patient who has coronavirus.
Okay. And what about, I was also thinking about antibiotic therapy, because I know that it wasn't that long ago we had a problem with antibiotic resistance. And so with the coronavirus, does it react to antibiotics? Is antibiotics one of the protocols for treating this, or no?
Because it is a virus, antibiotics are not, if you mean antibiotics to treat bacteria, are not going to help get rid of coronavirus. It's important to know that a number of people with coronavirus may also be getting, when we look at their chest x-rays, it looks like a pneumonia. And there's been data that you can have what we call viral pneumonia, and you're at higher risk for getting a bacterial pneumonia because your lungs are already injured and they're, so to speak, they're susceptible to other diseases and microorganisms. And so there are protocols where antibiotics are being for coronavirus. Part of it is for that reason, but the antibiotics themselves, such as azithromycin and things that you may have seen been reported in the media, are not helping to cure coronavirus.
Okay. And there's been a whole lot of talk, I'm sure you've heard, about vitamin D. And for a lot of African Americans, our vitamin D levels may be low. Not all, but for many, it is low. So how does vitamin D affect the corona? Is it because if your vitamin level is low, that means you're more compromised with your immune system? How does that come together?
We don't exactly know why. And so I don't have a specific, answer to your question in terms of having higher vitamin D levels or lower vitamin D levels and what that means for coronavirus, again, because we're learning more so about the disease. But I think it's an important data point to be aware of, because we are seeing coronavirus all over, but there are certain communities we're seeing it less, like in the Caribbean, and there's thoughts about, does it have to do with higher levels of vitamin D in those populations just from the sun itself? We know vitamin D is very important. We know that low vitamin D levels have been correlated with other things, such as a higher risk of multiple sclerosis, disease, your neurological system. And so vitamin D is important, but I tell people I would treat focusing on things like your vitamin D level as you would focus on other things, like other natural remedies, because vitamin D, unfortunately, is not going to cure coronavirus. Natural remedies are not going to cure coronavirus. But I think it's important to know what those things are, because they should be a part of your overall part of how you take care of your health, not as the only thing you do to take care of your health. Sometimes medical treatment is very limited. So for instance, we know that there's data, cinnamon really it can help diabetics in terms of controlling their sugars. I wouldn't want someone who has control diabetes to just eat cinnamon. That's not going to help their symptoms. They most likely are going to need care. So there's always a balance between the natural cures, natural remedies, and there's data on that. Things to work for us. The cinnamon, there's data about ginger and nausea, data about how cough, using honey in those who are greater than 2 years old. We know that there's stuff out there and this stuff does work, the things that maybe our grandmothers have used on us for years, but you have to use that and balance that in conjunction with medical treatment.
That's true. Because different things we've been using now, you mentioned ginger, they've been using ginger, turmeric, organic apple cider vinegar. I mean, different things, thinking that is going to cure the corona. And I think some of these are down-home treatments, and it may make them feel better knowing that, hey, I'm doing something. But I think even with, I read somewhere they were talking about increase, was it vitamin K or vitamin C? One of the two. So there's been it's been a run on the supplement stores where people are just trying to buy as much as they can. But with supplements, we still have to be worried, don't we? Because they can interact with your medication you may be on.
Yeah, and again, supplements can interact with your medication, and taking too much of anything can be bad. And we do have, cases of taking too much vitamin C can have bad effects on the body. And so people have to always balance these things and make sure that if you're using these natural things that's safe for you in terms of it's not interacting with if you're on any sort of medication.
Okay. What are some things we want people to know, our community, about the coronavirus? Because there's a lot of myths out there. In the beginning, I used to hear things such as African Americans don't get the coronavirus. And I used to wonder, well, why wouldn't we get it? Because if I'm exposed to someone who has it, I have the potential to get it. So where do you think some of that came from?
I think some of that comes from misinformation. Because in the earlier days, and even for some people, this was still called the Chinese virus, because that's unfortunately, we were seeing it in Wuhan province and unfortunately affecting our Chinese neighbors. But it's a virus, so it doesn't discriminate in who it infects. And as you can see, one reason we're doing this series and talking about this, it is disproportionately really affecting us and really leading to high numbers of more comorbidity and also mortality for our people. So that's definitely one of the myths that I heard. I hear a lot of myths about can it be cured through natural treatments, and there have been even cases of people who are saying that they had coronavirus and they feel that they cured themselves through whatever natural remedy. And I'm glad that may have worked for them, but we don't have any specific cures for coronavirus. And I think people have to take whatever information, understand that there's information, there's also misinformation, and so you do have to take everything that you hear. I think it's interesting to hear different perspectives and imperative that we do so, but fact check that information, because that information and misinformation does have to be resolved. There have been the latest I'm hearing is that animals can't get coronavirus. They can. I mean, animals can get any virus. What that exactly means for them, I'm not a vet, I can't speak specifically to that, but it's looking like I don't want anyone to run in the ER if they found out that their little foo-foo has gotten, their cat has gotten coronavirus, and if it looks like their cat is doing okay, but definitely they should check with their vet about that.
And there have been some people who thought that they had contacted it from their pet, and so then they started getting rid of them. And just like I have a dog, a Siberian Husky, they can get in fact, there's a vaccine for that, and she will be getting hers next month. So we know they get all kinds of diseases.
Yeah. So please don't go put down your pet for that reason. Like, no, I would hate that. That'd be so sad.
But some people are doing that. I think a lot of it, Dr. Craine, is fear. Just like for some people, well, number one, when it comes down to the testing, this is the other thing I wanted to mention. When it comes down to the testing, many of us don't have access to the test. Even if you go to a place where they're doing testing, they may not test you. They may say, well, you don't have all the symptoms. I've talked to several people, including nurses, who didn't have the classic symptoms that they were looking for. So the fever was normal, other things was normal, but they had the coronavirus. And they were told, you don't need to get tested. And I've met other people who have shared with me their story that they were feeling very poorly. They did notice all these subtle changes in their bodies. Also, one of the biggest ones was upper respiratory, difficulty breathing. And then when they would go to the hospital, they couldn't get tested. The doctor's office wouldn't test them because now they're only doing the telehealth visits. So that's a real big struggle for our community because all of us cannot get the test done.
Mm-hmm. Yeah, and I do understand and hear that perspective. I think one of the reasons that not everyone is getting tested we also have to appreciate there's only a certain amount of tests that can be available. And every place is different. I know particularly in my hospital, we're not just, it wouldn't be helpful to, let's say if someone comes with certain symptoms, but I don't think they're sick enough to stay in the hospital, which would be good for them, to just test them for the virus and send them out into the community when you're pretty sure based off of everything that you're seeing that they definitely have coronavirus. So it may be best in that reason to let them know you really think that's what they have. And let's talk to what we're going to do next to help take care of you during that time. Because we also have, unfortunately, a limited amount of tests available. And if you have someone who's really, really sick and you were trying to differentiate coronavirus from maybe some other type of disease, and that's the last test in the hospital, as you know, unfortunately, we've been struggling with different equipment in the hospital. And it would be prudent on that provider to not someone that unfortunately is not feeling well, but that is not very sick, for someone that is very sick and looks like they're staying into the hospital. And I think there is a reason for that. What I encourage also people to do is, because for us, we're not being tested maybe as much as other people, is to look for other avenues where you do have access to testing versus like basically you just want to get a test, whether there's certain drive-through centers that they do here in New York. If you do have a primary care doctor, sometimes they're able to order the test for you, and some patients have been able to basically do a self-swab and send it back to the appropriate healthcare lab. So just I think if you really want the test, I encourage you to look at different avenues to get that test.
I know Trump and Jared Kushner claims that there's enough tests for all Americans, and we know that that's definitely not the case because there's not enough for them to go around. Now, I live in the state of Illinois, and in news the other day, some of the hospitals are having people come in and have blood drawn to see if they're carrying antibodies. So is the antibodies going to tell them if you're someone that had it?
Again, there's data about how the antibody test may not necessarily pick up everyone that's had coronavirus. There have been cases where maybe someone has documented to have coronavirus, but they've actually tested negative. But from what the data that we've been seeing so far, it is a pretty good test. And so it's another way to see if you were exposed to the virus, because if you were exposed where your body could mount an immune response to fight off the virus, which is what the antibodies would show, that could be another avenue. Finding out maybe if you've had coronavirus and do you have some immunity from it. And there are different ways people are getting those tests, whether it's, for instance, I spoke to how a number of us are frontline workers, and if there's a way to get that test through your occupational health and you're interested in that, I encourage you to get tested. That's one thing that they're definitely offering here in New York. But there are also certain labs and facilities that are also offering the tests. But when I last checked, certain places it can be kind of pricey in the $100 range, hundreds of dollars range. So I don't know if that's just per lab, but that is another way to see if potentially you had coronavirus, recovered from it, and have a good immune response to it.
And that's going to affect you and many others, because let's say there is a fee and you've lost your job. Some people, for example, have not even gotten unemployment yet. So if you had to pay for the test, you may not be able to afford it. And then the other thing, there are some people who are afraid to ask because they feel that it's very invasive. You know, I've heard things that it is and some African Americans are afraid to get it because they're thinking back to the days of the Tuskegee experiment. So, you know, there's a lot of mistrust out there.
Mm-hmm. And I really do understand this medical mistrust. I mean, I've seen it in my own family. I totally understand. And there's history about the way we were treated during Tuskegee. A lot of the irony of that, a lot of what we know about how to take care of women with obstetrical and gynecological diseases has to do with the gross atrocities that doctors practice upon slave women. And
yes.
So I totally understand that. But I also encourage people to, with that medical mistrust, also I talked about how we can better use our resources and ourselves to move past certain things. And so one thing I would say with that, like I advocated having providers that look like you, but also you have to somehow kind of involve yourself in that medical community. So for instance, there are a number of clinical trials that are going on for coronavirus. We traditionally don't participate in a lot of those clinical trials. And so it would be a big misfortune to me if we're not involving ourselves in those clinical trials and we're eligible, and we are the people who are disproportionately negatively affected by coronavirus. And so I would have to encourage us to understand the medical mistrust, but how we can better navigate that so that we are able to better take care of ourselves and our health.
Okay. And you can find out more about those clinical trials from clinicaltrials.gov. Now, other thing that I've been wondering about that we haven't seen much in the news is demographics. They're really not talking about the demographics in terms of who's getting it, where, which areas. So the demographic information, I've been waiting to see more about that, and that has not really been forthcoming. Have you seen any of that demographic data?
I think it's going to vary per region. I know in the state of New York, some of our demographic data has shown that where our zip codes where we have a larger proportion of those with lower income, and those are disproportionately the incomes that also have a larger amount of African Americans, also Hispanic Americans. We are the ones that are more getting coronavirus and also dying from coronavirus.
Okay.
I'm sure, unfortunately, that if other states and cities would look at that data, and it looks like the different states and municipalities are trying to do this. I know there's a task force in New York and also in Oakland, California, where I trained, in Ohio, and also in Michigan, where they've been commissioned to better study the racial disparities as related to coronavirus. And so I'm hoping there will be real-time data that will come out from these initiatives, and then what they will do with that data. And I also encourage communities, Black Americans, to get involved with these task forces, make sure that this is made to better figure out why we're so negatively affected by this virus. And I want to make sure that we actually are involved in that conversation.
Okay, I thank you for your time today. You have a book, either a current one or either one in the process. Can you share with us about that?
Sure. I have a book coming out with a group of other authors. It's called Women in White Coats 2. It's about being a woman in medicine. It features women of all different ages and races. And we talk about all our different experience in medicine, ranging from, unfortunately, issues with racism, but also things like raising children. It's coming out May 26th. It'll be available on Amazon, and I encourage you to check it out.
Perfect. And that will be on Amazon. Well, I will be looking for that to share with my community. So you have the last word. Is there anything else you would like to share?
Well, as I mentioned, that our community unfortunately does know struggle, and we have overcome many struggles. We've overcome the struggle of slavery, the lack of civil rights, and we lost many people in those struggles, and we're just like we're losing people in the coronavirus. But I need us to remember that collectively, we will survive this as we have survived all the other struggles and any of the future ones that may come. I think the mantra of the 70s was that, I'm Black, and this is before I was alive, but I'm Black and I'm proud. And I would just add to that, I want the mantra to be for us during this time with the pandemic to be, I'm Black and I'm proud, and I'm also resilient, because we are.
I like that. I'm writing that down. I am Black. I am proud.
Yes.
Yeah. Those two things, along with, I think, our faith, is what's going to help us move past this.
Mm-hmm, definitely. And I look forward to a post-coronavirus world.
Yes, yes. Well, I thank you for your time today. It's been a pleasure to have you on Black Menace. Have a wonderful day.
Yeah, thank you for having me.